All right. Well, welcome to the COVID update for October 14th, 2020. I'm really excited to be doing this. And if there are any questions, please add them in the chat. I'm going to try to address as many questions as possible as we go through this. Obviously, we have had a lot of developments in terms of vaccines, in terms of treatments, and then just generally, things have changed and the landscape has changed. Now we're months into COVID. So new issues are coming up, everything from school to holidays like Halloween. In the US, we have voting coming up on election day, November 3rd. So a lot of things I wanted to kind of cover, and also try to make sure that it stays relevant to the questions that are coming in. So I will preface this with the fact that I'm in California, where the air has been a little bit less than ideal. So I have a bit of a cough from asthma, not COVID, which is really good to know. So mostly want to just jump in and start talking about a couple of the important things that I outlined. So starting with vaccines, the things that I would say are, there are a bunch of candidates. They're in phase 1, phase 2, and phase 3. And I wanted to just very quickly go over what that means, because a lot of people are like, how can I trust the vaccine? Can I believe that it's going to be safe for myself and my kids? With phase 1, when a vaccine is in phase 1, just keep in mind that that means that essentially it's a handful of folks, so maybe a few dozen folks that will get the vaccine. These are healthy, usually adult volunteers. They are checked for safety. So we're going to essentially at that point monitor them, make sure that they're not getting any side effects or anything like that from the vaccine. Once that's cleared, usually the next step is a phase 2 trial where the amount, the doses are varied. And so then you really get a sense of like, okay, how much do you really need to get into a person to get the response you're looking for? And so in that case, you might give a little bit more, a little bit less, and you really want to check and see if they're getting an immune response. And the best way to do that quickly or relatively quickly is to check their blood. So in that situation, you check their blood, you see what kind of antibodies they're generating, and you might say, well, wow, like I gave less of the virus here, but I still got a great antibody response. So that means that when you eventually decide on a dose, it might be okay to go for a smaller dose because it still seems immunogenic, meaning that it still generates an immune response. So that's again in phase 2. And that one, I said the first one is kind of in dozens of people. This one might be done in a few hundred people. So larger number of people. And of course, now that it's a few hundred people in phase 2, you still want to make sure that the COVID-19 vaccine is safe. So it's not like you stop looking for safety. You still continue looking for safety data. You want to make sure that hundreds of people now are safe instead of just the few dozen that you checked the first time in the phase 1. So if everything is looking good, phase 1 looked good, you didn't have any safety concerns, phase 2 looked good, you still didn't have any safety concerns, and you got some sense of like what dose to use, then you go to phase 3. And in phase 3, this is where you're talking about thousands of folks getting the vaccine. And again, still kind of healthy adults aged 18 to 65. Usually you're going to pick adults that are not immunocompromised, don't have any sort of other illness. So generally very healthy adults. And now you already feel pretty good that it's safe. You feel like you have some sense of what dose you should be using. And now you're checking for whether it's efficacious, whether it seems to work. And so here what you do is you take two groups of people, let's say one group that got the vaccine and another group that didn't get the vaccine, and you see which group gets COVID-19 at a higher rate. So you say, well, wow, like the group that didn't get the vaccine, they got COVID-19, let's say they got a lot of COVID-19, but the group that got the vaccine, they didn't. So if that was the case, you'd feel really comfortable saying, well, wow, this vaccine seems to be making the difference. And of course, you want to make sure the two groups are similar in terms of age groups and other illnesses and things like that. Like that shouldn't be the reason. The real difference should just be the vaccine, whether they did get it or didn't get it. So that's phase 1, 2, and 3. And then, of course, after vaccine is out there, which at the moment that's not the case, but after it does get delivered, then you go into post-release trials, or you're kind of looking at it after it's been released. And that's where you say, okay, now that it's in the world, now is it still working the way that we expected it to? So those are kind of the trials and how they work out. Generally speaking, because this is a question that comes up a lot, COVID-19 vaccine is likely to be given to some groups before others. So one of the first groups that is likely to get COVID-19 vaccine would be healthy healthcare workers. So these are healthcare workers that are on the front lines. It could be an ambulance driver, it could be a nurse, a paramedic, a doctor, any of those kinds of folks that are taking care of patients. They're in the highest priority group usually for vaccines like this. The next kind of priority group would be the elderly. So that would be the group that is most at risk for getting very sick with COVID-19. So that would be skilled nursing facilities, rehab facilities, centers where people are living kind of on their own with some help and assistance, so assisted living facilities, any of those kinds of places. So that would be the second high priority group. After that group would be adults. Just general adults in the population would be kind of the third priority group. And then the final priority group would be kids. That's typically how these are rolled out. And that's because, again, kids didn't get the vaccine in the studies. So we don't really know how it would affect kids. So that's why they usually wait until the other groups have gotten it. And we have enough data to see if it's safe, if it seems like it's causing any sort of strange or unexpected side effects, then we'd be more reluctant to give it to kids. So that's usually how vaccines get rolled out. So having said all that, I just want to start answering a couple of quick questions that have come in. One specifically on the flu vaccine, since we're talking about vaccines. And the answer is, the question is flu vaccine likely to help with fighting COVID? So keep in mind, COVID is caused by SARS-CoV-2, a coronavirus, not the influenza virus. So it's a different virus. But there's 2 points. One, when you get the flu, it's hard to know if it's the flu or if it's COVID, right? Like they're going to cause a lot of the same symptoms. So one thing is that getting the flu vaccine lowers your chance of flu and therefore lowers any confusion about what you might have and any reason you might need to go to the hospital. Because again, if you go to the hospital to get checked out, and let's say you get admitted, you're putting yourself at risk because that's a place where other people might have COVID. So if you can not use the healthcare system, not go to the ER, not go to the hospital to get admitted, that would be ideal and reduces your chance of getting COVID simply by being there. So that's one thing. Number two, there is no rule that says that two viruses can affect or infect the same person. So you can actually get flu and then your cells that are lining the lungs, they're destroyed or they're weakened. And then it's much easier for SARS-CoV-2 or COVID-19 disease to happen. So having the flu predisposes you or sets you up potentially for other illnesses. So for those two reasons, I would definitely get the flu vaccine and get it early. So go out and go get your flu vaccine if you're able to do that. So that's a quick question on vaccine I just want to answer. So now jumping over to treatment, and we will answer some of the other questions. I just want to make sure we get into treatment first. There's a question about how long does it take to treat COVID? So if you have COVID, then the first question is, do you need treatment, right? So a lot of people with COVID don't get specific treatment. They stay home, they drink soup, they get rest, they get better. A lot of people are in that category. Some people get COVID and their oxygen levels fall. You know, this happened with the president of the United States. He is obviously older, he's obese, so has risk factors, and was hospitalized because his oxygen levels fell. In that situation, you do get treatment usually. And the treatments are typically in two categories. So, and there's an example of a drug in each category. So one type of treatment would be an antiviral drug. And most people get that. They're like, okay, so it's a virus, so you're gonna treat it with an antivirus. I get it. So an example of an antiviral is remdesivir. Remdesivir basically attacks the virus directly. So that's one type of treatment. The other type of treatment is not at all an antiviral drug. It's actually like a steroid. A steroid is gonna help your immune system calm down. So a lot of the disease and the damage that happens in your lungs, a lot of it is because your own immune system gets so angry, so upset that it basically, your own immune cells are secreting or letting go of little chemicals that cause damage. You might think, why is my immune system doing that? Well, the reason is because these viruses provoke. Like, just think of like an instigator. The virus literally is like provoking your immune system, and your immune system sort of overreacts. And that overreaction can cause damage. Just think of an argument between two people. And the steroids help basically prevent that overreaction. They help to calm the immune system down. So those two drugs, remdesivir and dexamethasone, are treatments. Now, going back to like how long does it take to treat COVID? The fact is, it really depends on how sick you get. So if you get a little bit sick, let's say your oxygen level dips for a day or two, then that treatment course is going to be on the matter of days, right? Like, you're going to get steroids. You might get a steroid taper, which is usually a handful of days, and then you go home. If you get so sick that you get intubated, meaning a breathing tube is put down your throat and there's a machine breathing for you, then it could be weeks. It could be over a month where you're intubated in an ICU setting, because at that point, typically it's that inflammation that's gotten so out of control that that's what's causing the ongoing damage. So it really depends on how sick you get as to how long those treatments are. But typically the treatments themselves are on the order of days. And then sometimes the things that you need, like mechanical ventilation, that part of it could last for weeks. Okay, so that's on treatment. Quick question about vaccine, going back to that, I guess. Question is, when are we likely to have a vaccine? Great question. Let's start with saying that it's not like we have one vaccine candidate. We have many, right? So there are many, many, many vaccine candidates out there. So over 50 or so vaccine candidates out there. That's the first thing. Second thing is, there are some that are further along, like they're in phase 3. Those are the ones that people are looking at to say, like, hey, maybe one of these will be the ones that will be released. Now, think about the fact that, let's say one gets released, and there's one that's in phase 1 or even like pre-trial, so it'll take longer to get through. But let's say it's much better. So you might even imagine a scenario where we start with one vaccine, and then as another one comes along that's much better, we switch to a different vaccine. That could happen. Another scenario is that you release a vaccine and you realize you have to release it every 2 years. Maybe you need a booster. So it could be that you get a vaccine and then you get revaccinated in a couple of years. But to answer this directly, which I think is really the intent of the question, is like, when is the first vaccine likely to come out, and when will everyday people, like adults that are out there, be candidates to getting the vaccine? And I think the answer is probably somewhere around March to June of next year, meaning March to June of 2021, is when I expect a vaccine to be widely available to adults in the population. I don't think it's going to happen sooner than that for a number of reasons. And I think that there's a lot of pressure to not let it happen after that. So that's when I would say I would expect a vaccine, Q2 of 2021. Okay, so going back to kind of update issues. We talked about vaccines a little bit. We talked about treatment. The last one is masks. Actually, wanted to point out, masks are effective. There is no reason to think otherwise. Some people have said, well, maybe when you have a mask, you don't get enough oxygen in. And that is not true. The oxygen in the environment is roughly 21%. You can get that through a mask. And the mask can be useful for those that are sick with COVID, that are putting it out into the world. It's also effective for people that are breathing it in, so having a mask to filter. And that's why those valve masks, sometimes you see the N95 masks with the valve, they're not allowed in a lot of places, because with those masks, you're protecting yourself, but you're not necessarily protecting others because you're still breathing out through the mask. So those are just some points on masks that I wanted to make sure that we got in there. Let me see if there are other quick questions I can answer. One on getting COVID twice. So it's a good question. There have been reports of people getting COVID more than once. And typically when you dig into that, the reason that people say that is one of two reasons, or let's say one of a few reasons. One reason is they had COVID, they thought they got rid of it, but they didn't. And then they come back in sick again. And that happens sometimes. Sometimes with illnesses, you get better and then you get worse again. So that's one reason why that might be the case. Maybe you thought you got it twice, but actually you never really got over it in the first place. That's one scenario. Another scenario is you get COVID, you recover, and you think you got it again, but you didn't. So maybe the second time you had flu or something else, but you test positive for COVID. Now, how could that happen? Well, keep in mind that the tests are looking for virus genetic material, right? Like RNA or DNA. So in this case, RNA. So if it's looking for that genetic material, then you might have bits and pieces of the RNA, but that doesn't necessarily mean you have COVID disease. So that would be an example of where you test positive because it picked up the genetic material, but that doesn't mean you actually have the disease. You had it. You actually have a new virus causing disease. So that's the second reason why people often get this scenario. The third one, which is the one that I think we should be most thoughtful of, is can you get COVID disease, recover, and a few years later get it again? And that seems like it might be possible. We just don't know because COVID hasn't been here with us for a few years, right? So all we've had is about 8 months or 9 months to kind of learn about it. I think what we're going to have to do is once these vaccine trials come out is see how long that protection seems like it's good for. And that's what I said about boosters. Like maybe you do need a booster shot in a few years. And if so, then you would have to do that to prevent getting it again. But at the moment, we don't know how long that cycle is. Other coronaviruses do seem to show that there is a period of months to years where you're protected. And then after that, it seems to wane. So there is some kind of reason to believe that that could be true here too. All right, so that's the question about getting COVID twice. Now, a couple of things I just wanted to jump into, and I said it's at the outset, Halloween is coming up, we've got voting. Let me go through some of the thoughts on how to navigate these issues that are in front of us in a way that's responsible. So let's start with Halloween. If you are gonna be at home giving out candy, the way to do that would be instead of a big bowl of candy right at your doorstep where a big group of kids gathers, you individually wrap little bags, potentially, of candy or whatever else, and you put it, like, let's say at the end of the driveway, so people can come get it by themselves. They don't need to see you at the door, and they don't need to gather up in a cluster. If you are going to do that, obviously wash your hands really well before you put those bags out there. So that's one thing. Another thing you can do if you're going to be at home is decorate your house. A lot of people are doing scavenger hunts where they're walking down the street and they look for objects like a ghost or a spider or something like that. So you can actually decorate your house and allow people to kind of enjoy that experience because they can look for stuff on your house. So that's for people at home. For parents that are going to do something fun with their kids, the safest thing, of course, is do something in the house, like watch a movie or dress up in the house. And that's a really cool experience for a kid to kind of see their parents get into it. And that could be a really great thing and a safe thing to do. You could also do something virtually, like maybe a virtual costume contest. If you want to do something in between, you could, for example, go to a movie night outside and separate it out. So spaced out and have a big movie showing in a common park or something like that. You could do a haunted forest instead of a haunted house. Haunted forest is outdoors, spaced out, have people kind of walking far enough away from each other so that everyone can kind of enjoy that experience. You could potentially, and this would have to be done safely, but you could do pumpkin patches and apple picking as long as people are doing it in a way that's outdoors, spaced out. So you get the theme, outdoors, spaced out. What you don't want to do is indoors. You don't want like parties. You don't want people coming together in a haunted house or something like that. And anything you do, you want to make sure it's spaced out as well. So not just indoors, but even if it is outdoors, don't do it in a way that's everyone together, especially because of Halloween. There's gonna be a lot of screaming and yelling. So you're literally like aerosolizing this stuff out. So as much as you can, keep it really, really outdoors and spaced out. Voting, similar logic. If you can vote by mail, do that. That's the easiest thing, right? That keeps you safe, completely safe. Drop it in the mailbox and you're done. And there are, of course, registration deadlines to do that. So make sure you check out vote.org. And there are state deadlines you have to look at. Make sure you do that if you're going to be voting from home so you can take advantage of by mail voting. So you don't have to go and stand in a long line, because of course that's where the risk is highest, especially if you're a high risk person yourself. You want to avoid that if you can. So let me jump into the questions now. What is the impact, what about the impact COVID can have on your future health? So this is a good question. I think a lot of people forget that with COVID-19, it's not just that it causes you to either live or die. It's not like a light switch on or off. That there are a lot of people that get COVID-19 and then weeks later, months later, they still have disease, in the sense that their lungs had to deal with this and their lungs are scarred, and that's called pulmonary fibrosis. And if you're, let's say, a world-class athlete or even like a good athlete, if you have pulmonary fibrosis, that's going to change how effective you are. Maybe you can't run as fast. Maybe you can't swim as far. So a lot of those kinds of things are affected when you're dealing with scarring from COVID-19. So that's one thing about long-term impact. Also, we're seeing that sometimes weeks out, kids specifically can get an inflammatory response. And it's called MIS-C, MIS-C. And MIS-C is this thing where like you get COVID, your kid gets COVID, and then 6 weeks or so later, there's an immune response again. And you get fevers, you get red swollen lips, you get bright red eyes. Like a lot of these things are starting to be seen that look like this other disease we call Kawasaki, but it's an inflammatory disease. The whole body's inflamed in this child. And one of the areas that are vulnerable are the blood vessels of the heart. And so that's something that we've seen. We've seen this, we've talked about it now and reported on it with kids. We're also seeing this with adults. So even adults are getting this kind of post-infection, 6 weeks later, inflammation, like inflammatory response. We're not sure exactly why it's happening. That's unclear, but it has been documented. It's been reported on. It's now being studied. So that's another thing that can happen after COVID, and people should kind of watch out for that and look out for that. Question here about a second wave of COVID being more aggressive. I think the big danger right now is that so far we've been dealing with COVID without having to worry about flu. It goes back to the first question about flu vaccine. Now with flu, a lot of people are going to be hospitalized with flu. I mean, it happens every year. We're going to see more people get diagnosed with some sort of pneumonia. We don't know if it's flu or COVID. And remember, the testing isn't always perfect. So in many cases, you'll have a patient who's just really sick, and you won't know if they've got COVID or flu. Maybe they test negative for both, but you believe it's one or the other, right? And so that's going to happen more and more and more. And the question is like, how do you deal with these people? Do you have to put them on a certain floor in the hospital? If so, which floor do they go on? And that's the problem with flu, is that it becomes a big copycat or a mimic to COVID. And then as a doctor or a nurse, you don't know how to handle those people very effectively, because you don't want them to get COVID if they don't have it. And the flip side is if they do have it, you don't want them to spread it. And you don't always know. So that's the big challenge in front of us around a second wave of COVID. Of course, the numbers are going up in the US nationally. This is directly linked to bad behavior. Good behavior would be wearing a mask. Bad behavior is essentially not wearing a mask. And so if you're not wearing a mask and you're in a public place and you're socializing, a lot of people around, you're putting people at risk. And that is directly related to why we're seeing an increase in cases again. And it's happening nationally. And so that's really a tragedy. And this is going to keep happening until we have a vaccine, and we're going to see more cases, and then we're going to be back on our good behavior, and then we're going to see more cases back on our good behavior. It's becoming a cycle. And it's a cycle of fatigue, and it's a cycle of kind of leadership. When you see your political leaders not doing things, then you think, oh, maybe I don't need to do it. So those are the things that we're going to have to deal with as time goes on, is how do we deal with fatigue around these good behaviors that we need to do. Okay, so another question is, after COVID diagnosis, is a lack of symptoms justifiable for recovery, or is a negative test required? Great question. A lot of people with COVID do not get symptoms. So having said that, what that means is they have live virus, not just genetic material, but live virus in their nose, in their throat, in their mouth. And that live virus is very capable of getting into the air. As they talk, sing, breathe, that virus is getting into the air. And so they are contagious, even though they may not have symptoms. And what you need to do is get a negative test. And that negative test looks for genetic material. But if you have live virus, you'll likely have genetic material. And that is the best way to show that a person is not contagious. So just to reiterate, just because you don't have symptoms after COVID does not mean that you are not contagious. The best way is with a negative test. Okay, so how fast can COVID symptoms appear after getting infected? So after an infection, typically it takes about 5 days. 5 days is the incubation period. That's considered a median. Sometimes as quick as 2 days, sometimes as long as 2 weeks. And that's why we have a 2-week waiting period, if you're curious. But typically around 5 days. So if you are in contact with someone and let's say that person has COVID, and in that moment, you got the virus, it came across to you, you can expect that it would be a few days before you start having symptoms. Okay, so then let's see, one final question. Do mutation exist in the genome for SARS-CoV-2 during the pandemic? And then how does that affect future vaccines? You can have mutations. They're being tracked really closely. Most of the mutations are not in the part of the virus that we have a vaccine against. Most of the vaccines are against the same protein. It's called spike. And so that protein is not mutating very much. Other parts of the virus are, but that protein is not mutating much at all. And so the vaccines are relatively stable, meaning that I think if you get a vaccine now, you should expect that it would work even if the virus mutates in other areas of the virus, because that part is, as I said, pretty stable. So that would be the takeaway in terms of how to think about mutations with respect to immunity and vaccines. So let me just wrap up. I realize we have 2 minutes left. I want to be mindful of the time. Given that it's a precursor to the holiday season, we're going to be checking in again next month, especially as we approach even more holidays. You know, we have Thanksgiving and then Christmas. First and foremost, remember to take care of your mental health. We didn't talk about that much today, but that is increasingly, I would say, the growing kind of issue that we all have to deal with is issues of loneliness, depression, anxiety, especially even tied in with like unemployment and just future prospects of kind of the existential threats that we're all kind of watching. So remember to take care of your mental health. Try to do that with regular calls with friends and family. That could be phone calls, Zoom calls, writing a letter. That's something that I've actually started doing, meaning pen and paper. So those are great ways to stay in touch with friends and family. And then ultimately try to stay positive, stay active, eat well, sleep well. Those are the foundational things that are going to keep you at your best. And so with that, I'll just say thank you so much for joining. We want to make sure you always know that we have your back. Take care.